Dear fellow Toastmasters, how are you? This question has two meanings. I'm asking you about your physical health and your mental health. But let's be honest, this how are you question has been neglected for so long. We don't really pay attention to the question itself. Most of the time, when we are asked the how are you question, we just say, I'm fine, I'm okay, all right. And you? We don't really answer the question. And even worse, we don't really ask the person this question. Fellow Toastmasters, although how are you question seems simple and common, this question is very powerful and meaningful, especially in this kind of the day. During COVID-19 pandemic, we all face difficulties and struggles. In fact, we don't only fight with the virus, we are struggling with our life. Some people lost their contact with their beloved one, locking themselves in a house or even isolation room. Some people lost their main income job and causing them starving and homeless. And even worse, some people lost their families and their lives. This COVID-19 pandemic does not only affect our physical health, but also our mental health. As stated by Nasir in Asia and Pacific Policy Society, it is evident that Indonesia has encountered a serious increase of mental health due to the COVID-19 pandemic. The National Alliance on Mental Illness, moreover, reported the demand for mental health resources has skyrocketed by 41% just in 1 month. OECD did a research in 2020 also reveals that youth or young adults express greatest concern about mental health during COVID-19 aside from unemployment, education, and even the disease itself. So what is mental health and how important it is? According to medical news today, mental health refers to cognitive, behavioral, and emotional well-being. It is all about how people think, feel, and behave. Mental health can affect people's daily living, relationship, and even physical health. As stated by World Health Organization, there is no health without mental health. Mental health is not the same as mental disorder. However, poor mental health can lead to the conditions such as stress, anxiety, depression that can contribute to physical illnesses. Even in Bradley University site, it shows that depression has been linked to a 50% increase in a person's risk of dying from cancer and a 67% increase from a heart disease. So what is the relation between mental health and COVID-19? We know that COVID-19 is a virus that affects people's physical health, and the governments are strongly encouraging us to do social distancing and lockdown. However, during the process, millions of people feel depressed, isolated, and anxious about everything. These kind of mental problems can lead to physical symptoms such as headache, diarrhea, constipation, insomnia, sleep problems, and even constant fatigue. This kind of physical symptoms can weaken the immunity of a person and make them more threatened to the COVID-19 virus and also the other health problems. Not only that, these mental problems can also lead to other issues such as drug and alcohol abuse, self-harm, suicide attempts, or violent behavior. We know that all of these things are part of our life. Every year, people suicide and kill themselves. but COVID-19 became one of the reasons. From the Washington Post on May 2020, it is reported that COVID-19 healthcare workers committed suicide due to the emotional weight of the pandemic outbreak. There were too many patients, they cannot hold it anymore. So what can we do about it? So from here, we know that COVID-19 does not only attack physical health, but also mental health, which also can lead you to the death. So first, acceptance. Know that it is okay to feel sad, angry, confused, stressed, and depressed during this crisis. We don't know when it will stop. However, talking about it to people you trust, like your family or friends, can help you to release your emotion. If needed, go to the professional. It's okay. It's totally okay to take care of your mental health. Remember, mental health is as important as your physical health. Again, filter the information. Nowadays, we are overloaded with the information from social media. Come on, get the facts from the credible sources like World Health Organization or public agency. Sometimes you need to limit the information because although it is very informative, it can be very overwhelming. Focus and use your time to the hobbies that make you more positive about yourself. Next, last but not least, maintain a healthy lifestyle. Even though we are locking down in our house, it doesn't mean that we cannot maintain a healthy lifestyle. Make sure you have a proper diet, sleep, and exercise. Going to a jog for 1 hour per day, it will help you to release your emotion. Last but not least, we know that coronavirus is very overwhelming. However, we are in this together and we will get through this together. And again, try to reach out your friend and really sincerely ask your friends, how are you? Back to you, Tom.
Okay. Give